Okay, can everybody see the presentation screen okay?
Yes.
Excellent, thank you.
Yes.
Okay, great. All right, good evening, everyone. Welcome to our December seminar, the final installment of our 2022 monthly seminar series. I'm Shannon Salento, Community Development Manager with Sullivan Renaissance. I know many of you are here because it's a great opportunity to get some last minute training credit hours if you're on a local planning or zoning board. So welcome, I'm glad you're here with us tonight. It is great to see a bunch of familiar faces and names, but also some people who might be new to Sullivan Renaissance. For those of you who are new here, Sullivan Renaissance was founded in 2000 by Sandra Gary to fulfill her mission of making Sullivan County a beautiful, vibrant, healthy place to live. What started as small grants for community groups to plant gardens and flowers has grown to 3 really robust grant programs with a variety of grants to fund different projects from $500 to $350,000, plus an awesome volunteer and intern program, horticulture and technical assistance, and a lot more. And we do have a decent amount of our team is here tonight. Christy Turbush, Carmela Ugal, Alan Carroll, they are here as well as resources. And yeah, so thanks for being on tonight, team. I also would like to mention that we are soon joining forces with our sister organization, Sullivan 180, which is committed to turning our county health rankings around 1 degree at a time. So together we will combine all of our resources and remain focused on health and community development. But youth and the next generation will really be central to everything that we do. Amanda Langseeder from Sullivan 180 is on the call, I believe. And I'm not sure there's a lot of people here, so I apologize if I miss anyone else from the team. But again, Sullivan 180, another great resource for our communities. And with that, tonight we are discussing housing. So we're going to be looking at some housing issues in Sullivan County and how housing conditions can impact health and community. This is really timely because Sullivan County has recently adopted a new comprehensive housing strategy. And that's something we should all be thinking about as we move forward in our various roles, whether you're on a planning board, a municipal official, a nonprofit professional. There's something in there, I think, for all of us to be able to help with. So who are these panelists that we have tonight, this expert panel? We have John Little, Commissioner of the Sullivan County Division of Health and Human Services, Adam Bosch, President and CEO of Hudson Valley Pattern for Progress, and Jill Wire, Deputy Commissioner of the Division of Planning and Community Development and Executive Director of the Sullivan County Land Bank. I told her before this call that she has the longest title in all of Sullivan County. Each of these panelists bring a different perspective, approach, experience. So we'll kind of start at a global level with John, and then Adam will discuss the housing landscape in the Hudson Valley and Sullivan County. And then Jill will go over the housing strategy and how we can implement it into our work as municipal officials and partners. During the presentations, if you have any questions or comments, feel free to drop them in the chat, and we'll have a conversation after with the presenters. And I do also want to mention that if you are here to get credits tonight, we will be emailing the certificates out to you after the program in the next couple of days. So you will receive your credit certificate via email, whatever email you provided us in the registration. So that will come in a few days. So let's get started without further ado. John Little, like I said, is the Commissioner of Health and Human Services, the Division of Health and Human Services at Sullivan County. And he is going to be discussing some great things that we all need to hear about. So John, take it away.
All right, thanks, Shannon, and good evening, everyone. Good to be here. And what I'll be talking about is how communities and health, and it's really good that Shannon said, from a global perspective, because that's, she also said experts. I don't know if I qualify in that particular area, but I am a I'm a military veteran, and I joined Sullivan County's Health and Human Services team, really because of my leadership and planning management background. I'm not a social worker or a public health person by trade, but I am really passionate about the things that we work on. I love the work that I do. I have an amazing team in Sullivan County Health and Human Services, which, by the way, is social services, of which I am the commissioner. That's my primary duty. And one of our primary focuses is on housing, and in particular, emergency housing for folks that are homeless. But then also, I have oversight of the Department of Community Services, which looks after the county's mental health. And they have a role in housing as well, in particular because of the need for supportive housing for folks that have challenges, whether they be with their mental health or substance use. We want to make sure that those folks have an opportunity to live in the communities that they love as well, in a way that is safe for them and safe for the community around them. And then, of course, there's Sullivan County Public Health, and Sullivan County Public Health really does a lot of the things that that we all know and well at this point in our lives, with responding to infectious diseases like COVID-19 and the flu. And then they also put a lot of work into kind of shepherding the county through the work that we have to do to improve our collective health. So this is something that we as a division in county government have been very focused on over the last couple of years. We really want to turn around the rankings. Sullivan 180 has been at it, and we love the partnership we have with Sullivan 180, helping to bring better health to the community. I think everybody on this call is aware that Sullivan County in the last Robert Wood Johnson Foundation rankings was placed 61 out of 62 New York counties, which certainly doesn't sound good. It's not good, and there's a lot to work on. But I would also say a more recent survey that we saw this summer came from U.S. News and World Report. It ranked us 58th out of 62, which is certainly not something to be excited about. 58 isn't really great either, but it is better than 61. And I bring this up in particular because of a couple things. Number one, that number 58, and coming from U.S. News, what's interesting in the way U.S. News does their rankings is that Sullivan County ranks, while we're low in the state of New York, we actually rank in the better half of rural counties nationwide for our health. And a lot of that is due to the natural beauty of the Catskills, clean air, clean water. But what holds us back, according to U.S. News and World Report, as far as the community's health, is all of our housing challenges of people that have trouble affording housing, of people that are in unstable housing, and those sorts of things. So that's what holds us back as far as that particular academic review is concerned. Talking about the 61 out of 62, that comes from what is kind of known as the gold standard for county health rankings nationwide. It comes from the Robert Wood Johnson Foundation. And that's where this slide that you're seeing right now comes from. And so the good news for us is, for all the work that we have to do, Robert Wood Johnson Foundation has given us a playbook, and that's what you're looking at really right now, is 4 considerations to improve health and well-being for all. And when you take a look at the top left of this slide, a term that if you work in this space for any length of time, you'll hear it very often, is social determinants of health. And when we say social determinants of health, we're not talking, that word really means something, determinant. We're not talking about social factors of health. We're not talking about social issues of health. We're not talking about social concerns of health. We're talking about determinants. And what you see in the slide there is, of all the factors that go into deciding whether or not a community is healthy, socioeconomic factors, those social determinants, they drive it. That's 40% of the ranking. And so a lot of folks, I think, around the community, and rightfully so, think that, well, we have a small rural hospital, or we have an obesity problem, or it's hard to get to a doctor, so that's why our community health is bad. In fact, that is a factor, but it's not the most important factor. The most important factor is where we live. Where we live often determines how we feel and how healthy we are. So that's why it's so important to discuss public health and housing together in the same conversation. So that's a big piece of what's going on here. when you look at the coalition that we've put together to work on this, Robert Wood Johnson has shown us that you need a broad and diverse partnership to work on all these issues, because the issues that come up, and let's talk specifically about how housing impacts health now. Housing and its relationship to health, it's not just a concern. Certainly the most urgent and immediate concern that I deal with on a day-to-day basis is when somebody presents at the Travis Building in Liberty saying, I got kicked out, I don't have anywhere to go. Those folks that live on the street for any length of time, I learned recently from an academic study that the average life expectancy of anybody that has been on the street for 6 months or at least 6 months, their average life expectancy is 52 years old. So when you think about the average American being 77, 78, think about what homelessness does to the health of a community. And so that impacts all of us. So, you certainly hope that you would never be in that situation, a family member would never be in that situation. But when somebody is chronically homeless, it lowers their life expectancy by somewhere in the neighborhood of 25 years. And that really hurts a community's health on so many levels. So that's an important piece. But like I said, talking about our folks in community services, there's also supportive housing. So people can debate the policy merits of a lot of these things that I'm going to be talking about. But one thing that did happen in New York State, mostly in the, I want to say 1970s and 80s, was the move toward deinstitutionalization. So getting folks out of insane asylums and returning them to the community. That's something that was like a lot of politicians' policies that are out there. It's well-intentioned and not always implemented well based on how the laws are drawn up. And one of the impacts of deinstitutionalization was folks came back into communities from asylums where they were in the 70s and 80s, and they are living amongst the rest of the population. Now, deinstitutionalization, giving folks a home instead of an institution to live in for their lives, that's certainly an admirable goal. But what comes with that, or needs to come with that to do it right, is folks have to be provided with services in their community. Now, we are fortunate in Sullivan County. We have New Hope, Center for Discovery, ARC of the Greater Hudson Valley, I think they're called now, Sullivan ARC back in the day. These groups provide those sorts of services, but having access to the housing that they need and the services together has been very hard to do. The mental health components have been underfunded for many years. So a couple of things that I'm always working on are homelessness and supportive housing for those folks in need. But it really goes across the entire spectrum. And so that's, I think when we were going through our immediate prep right before, I saw a slide that Adam had on childcare and the impacts of that. The Sullivan County Child Care Council is a part of this discussion. All sorts of different agencies get involved because it's not just about these emergency situations that I deal with in social services, but we also have to have a healthy housing market to support folks that are able to get market rate housing, that are starting out their careers and need a starter house or need a condo, but don't necessarily need 2,000 square feet for 2.3 kids yet. And there's also there's also Section 8, which can be a dirty word in some places sometimes, but some of the things that I've seen with Section 8 is that is a bridge from folks that are in unstable housing to being able to buy market rate. And there's actually a lot of great programs out there that the Monticello Housing Authority and HUD in general have to help people make that transition towards the American dream. And when you think about all those things put together, that should be our goal, is to have a complete housing continuum that provides housing for folks at every one of those steps, because that gives us an opportunity to create community. And really what a lot of this is about is creating stability for folks. And with that stability comes bonds in the community and stronger schools and things like that. So it becomes kind of a gratuitous cycle where if folks are more stable in their housing, and as you create opportunities up and down the spectrum for folks to be able to hang their hat, then we're so much better off as a community because folks have that stability and they're not moving from place to place. So I'm sure I'm sure Adam and Jill can talk a lot more to how all that works than I can. But that's what I think I will lead off with. Shannon, if you could go to the last slide that I have. I did want to share with folks a little bit about how all this fits into the grand plan. Like I said, social determinants of health is the biggest piece. That's the third column on this slide. But we have four pillars, the 4 E's, I often say, of what we are focused on in Sullivan County Health and Human Services and all the people that we work with, that we partner with. We are trying to ease access to care. And we've been pretty successful in that over the last year plus, bringing in more substance use providers. We have a public-private partnership coming together to expand pediatric mental health services in the county. The challenge, of course, is finding primary care doctors that can support the county. And that's another key piece of all this is you got to be able to recruit the services. And it's kind of a chicken and the egg, I guess, but you can't have good services without good housing, and you can't have good housing without good services to kind of encourage people to come in. So all of this needs to be built together. It has to be thought of as one, complete ecosystem. We're working very hard on ending the opioid crisis. We have a very active drug task force. Wendy Brown and our soon to be departing district attorney have done a wonderful job of leading us in getting after the drug problem. Fortunately, we did see a decrease from 2020 to 2021, and that's not something that you see with more than half the state or more than half the counties in the state. So we still have a very, very significant drug problem in this county, but it has gotten better from 2020 to 2021, and we're hoping that we'll see similar statistics in 22. The key reason that everyone is here, though, is for that enhancing communities, the third pillar. The fourth one, encouraging healthy behaviors. Very fortunate to have folks from Sullivan 180 working with us on improving health, reducing chronic disease in the county. But really that third one where we're all here for tonight is making sure that we have stable housing for folks by keeping them in places that they're renting, coming up with a comprehensive housing strategy that I'll tee Jill up to talk about when she comes up here in a little bit. And really working on all pieces of this, trying to get folks off the street and into housing and into better solutions as you go across the housing continuum. So I think that's where I will end my piece and ask if I can answer any questions before I drop off.
Thank you, John. I appreciate it. And if anyone has questions, you can either put them in the chat box or just unmute yourself and ask away. Okay. Well, we can also entertain questions later as well. So with that, we're going to move on. Thank you so much, John. And if anyone asks any questions that are specific to you after you have to hop off, I'll be happy to get those questions to you afterwards. Moving forward, we have Adam Bosch. Adam is the president and CEO of Hudson Valley Pattern for Progress. And Pattern for Progress, he'll tell you more about, I'm sure, but they're a Newburgh-based not-for-profit policy, planning, advocacy, and research organization whose mission is to promote regional, balanced, sustainable, and equitable solutions that enhance the growth and vitality of the Hudson Valley. So Adam will discuss kind of the regional perspective, but also focus on Sullivan County as well before Jill tells us about the housing strategy. So Adam.
Great. Thanks, Shannon, and thanks everyone for showing up digitally to hear me share some of our research. Shannon, if you want to go to the next slide, I'm just going to jump right in. So, as Shannon said, Pattern for Progress. I mean, we're a nonprofit founded back in 1965 by the region's academic, business, and government leaders. I mean, back in the 60s, the region was going through a lot of interesting changes. We had urban renewal happening, we had sprawl happening. We had technology and innovation happening at places like IBM. We had Stewart Airport down in Newburgh being sold by the Army or given up by the Army and put into private hands. And back then, a big group of leaders from across the region, including Sullivan County, got together and said, hey, we need an independent organization and nonpartisan organization that will do research and do planning on the issues that matter most to the region, so that we can start to make smart decisions about all these different trends that are happening around us. And that's how Pattern was founded. And so today we carry on that mission. And the biggest part of our mission, I would say on a percentage basis now, is related to housing. We run something called the Center for Housing Solutions. We do a lot of housing research, housing reports, housing plans for communities. And so this is something that we've built some expertise around. And we have a lot of staff working on the issue of housing. Go on to the next slide, Shannon. I'm going to dive in and I'll come back to this slide at the end. So tonight I'm going to talk a little bit about workforce needs, because workforce and housing are inextricably connected. And I'm going to talk about some of the other trends we see across the region that are making it harder and harder for people to afford housing. But first, I'm going to start with this. We have some really significant workforce needs across the region right now. In fact, we have a workforce misalignment across the region, and that misalignment comes in two forms. One form of that misalignment is related to training, where we have workers that are not trained in the things that we have demands for. The other form of that misalignment comes in the form of quantity, or you can think of it as a math problem, where we actually have not enough workers that we need. We don't have enough workers. We don't have as many workers as we used to. If you look across the region right now, these are actually the top workforce needs across the region. Across the 9-county area, about 40% of all job listings right now are in healthcare fields. And that's the full spectrum of healthcare jobs, from doctors all the way down to lab technicians, CNAs, respiratory therapists. There's also a lot of jobs open, as I'm sure you're aware, driving around, communities across Sullivan County in food service, tourism, and hospitality. Warehouse workers, especially in Orange County, Putnam County, are in high demand, but not in high supply. Construction trades, there's a lot of money on the street right now for construction projects, but we need more people to build them. One of the top skills in demand right now across the entire region is CDL drivers. We do not have nearly enough CDL drivers. I mean, if you had a CDL license right now, you could almost go write your own paycheck, because whether it's construction companies, bus companies, shipping, warehouse, and logistics, everyone is looking for CDL drivers, and they're having a hell of a time finding them. Information technology jobs, emergency medical technicians. This may shock some of you, but we actually have EMT, emergency medical technician deserts across the region where there is no active EMT service. And they're relying on mutual aid from neighboring communities or neighboring towns. One of the most interesting ones is actually the city of Beacon in Dutchess County currently has no EMT service. So that's a problem. Wastewater, water treatment, other utility workers, and then administrative and management positions as well. Big shortage there. Next slide, please. So where's that next slide? So this is blank on my screen.
Hold on, yeah, it's blank on mine. Just give me one
Well, I think
second.
the next one, maybe it's, let's see. Here I go. All right, so everyone now should be able to see in one moment. Okay, now everyone should be able to see my screen. Can everyone see that fine? Okay.
Thank you.
Okay. So I'm going to go through, okay, so those are the needs. Now, Pattern for Progress was involved in helping the state do a survey of job seekers and employers. And what we found was really interesting. On the left, this was the skills or the positions that employers said they were in most demand across the region, having the hardest time filling. So there you'll see some of the things we just talked about, right? You'll see different types of nurses, social workers, things that are connected to the medical field. You'll see the CDL drivers are 4th highest in demand across the region. You'll see some of these administrative positions, very, very difficult to fill. You'll see carpenters, you'll see sales, you'll see project managers, mechanics. All these fit into that list that I just showed you. At the same time, they surveyed job seekers, and this is very interesting. Look at the way that the interests of job seekers has changed from 2021 to 2022. This is a problem. So one of the places where we're lacking workers right now is in retail trades, right? People to run our grocery stores, other sorts of shops. And look, the interest in working in that has gone down from 13% to 7%. It means about half as many job seekers are interested in working in that trade now as they were a year ago. If you look at healthcare and social assistance, where we have 40% of our job openings, 16% of people who were working in that back in 2021, now only 11% of job seekers are interested in finding those jobs. It's that we didn't follow up and ask why. Some people may have been turned off by the pandemic and didn't enjoy the experience they had working in healthcare in the pandemic. Some may not like the mergers that are going on. I mean, there's a lot of reasons that could happen for that. You look at some of the others, accommodation and food services. These are our hotels, our resorts, our tourism destinations, our restaurants, from 11% down to 5%. I mean, there are some real structural challenges here in our workforce between the demand side and the supply side. There is growing interest in construction, utilities, management of companies. That gets into some of the administrative stuff, and professional, scientific, and technical jobs. But in the places where we tend to have the highest need right now, we're having dwindling supply. And that structurally for our economy is a tough thing. Now, in some cases, it's really interesting. You have, again, this same chart on the left of the jobs that employers are having the hardest time filling. And on the right now, you have skills that job seekers said they were most interested in receiving training for. So if you see this, there's actually a significant amount of overlap. So yes, the fourth most in-demand skill is CDL licenses. Surprise, surprise, the fourth most in-demand thing people like to be trained in is having a CDL license. So the interesting thing here is even where our interests align, we're having a really hard time finding each other. We're having a hard time getting the training for the people who would like to have the training. Well, why is that? When you begin to ask the job seekers, hey, why aren't you just going out and getting trained in this stuff? There are some really big challenges that they feel when it comes to training. Number one is the cost. Some of these people have college debt already and don't want to accumulate more. Some are living paycheck to paycheck, month to month, as you'll see in a minute, and don't feel like they have the ability to borrow or go out and pay for it on their own. Some people, are like, have kids and they don't know where to put the kids. I mean, they just don't know how to go get trained when they have children. Transportation is a big challenge for many of these folks. Some just simply don't know where to start. So we have some real workforce training issues, getting people into programs that can get them trained in the things where we have significant needs. This is a near-term issue that we need to be concerned about. But there are other challenges that go along with this. And I'm going to talk about each of these a little bit: housing, childcare, college debt, and the way that these things affect our demographics, and ultimately getting back to sort of the core theme of the night, our general community health, societal health. So let's start with home ownership. Home ownership. Sullivan County has a really interesting home ownership story, right, Jill? I mean, you figure during the pandemic and in the year leading up to the pandemic and during the pandemic, the median sale price of a home in Sullivan County doubled. I mean, on a percent basis, your median sale price went up more than any other county in the entire region. Not on a net dollars basis, but on a percent basis. So housing, the construction of housing across our region has been very, very low now for about 2 decades. We have been building less housing than other comparable areas across the country that are in similar distance to a large metro area as we are to New York City. The cost of homes have skyrocketed as a result. You have increasing demand, but supply that is remaining static. We also have an interesting thing that's happened where we've had the migration of lots of people up into our region during the pandemic, which increased the competition for the existing housing stock and drove the price up. We have this thing now where it's really hard to build more supply because of the cost of construction materials, some of the supply chain difficulties, and the labor shortage. And now, of course, we have rising interest rates that are going to make it, equally hard to build more supply. A healthy housing market has usually somewhere around 6 months of supply on the market. Across the region, we have about 2.5 to 3.5 months. And in Sullivan County in particular, I think we've been hanging around 2.5 months or so. I'm looking here. No, actually, you're the healthiest. I'm sorry. You got around eight months of supply hanging around on the market. So this is a problem. You can imagine as people are trying to save up for down payments and closing costs and to be able to go buy a house, to have the median price double in Liberty, in Thompson, out in the Western Rim. I mean, it means that as people are trying to grab that thing of home ownership, it's actually running away from them at a greater pace. So these are the sorts of trends we really need to concern ourselves with. At the same time, what we see is as people can't get into home ownership, we have more and more people staying in rentals for longer. And that can both drive up the cost of rent, but also it doesn't free up those rentals for people who are coming up, younger people, frankly, poorer families who need those rentals to be open and available for them to move into that portion of the housing stock. So we've seen rental, fair market rent across the region go up. Again, in Sullivan County, it's kind of interesting because you're a little better than some of the counties we see in terms of, average rental wages compared to fair market rents. So you're actually almost at a break even for a 1-bedroom apartment or a 1-bedroom unit, 1-bedroom home in Sullivan County. So in Sullivan County, your average renter's wages are $15.26 an hour. And that is about break even with what we call affordable. When it comes to rent, when it comes to housing costs, we consider affordable to be 30% or less of your total income should go to housing. If more than 30% of your income is going to housing, you're considered cost burdened. If more than 50% of your money, of your income goes to housing, you're considered severely cost burdened. So in Sullivan, you're at about a break even for a 1-bedroom apartment, and you're falling a little short for a 2-bedroom apartment. But if you compare yourselves to, say, some of your neighbors, Orange is in a little bit of a tougher position. You go across the river and down the river to Putnam and Rockland, and they are just swamped. Some of their workers could work 80 hours and still not be able to afford a 1-bedroom home, a rental home or apartment. Let's follow this through. The other thing that's important, this is now digging a little bit into policy and getting a little bit into the policy details. A lot of times when our communities try to set housing policy, one of the things we look at is the AMI, the area median income. And so if someone's coming through to build, a new apartment building, a new set of townhouses, it's often that we'll include a provision in zoning that says a certain percentage of those new homes have to be made affordable for households at a certain percentage of AMI. And oftentimes what I see across the region is that number ends up being 80% of AMI or 60% of AMI. But if you look here across our region, well, the average renter is making closer to 40 to 50% of AMI. And what that means when we set those policies at that level, we're actually not cutting deep enough to make those units, those homes affordable for the majority of our average renters. In Sullivan County, again, you're a little better. Your average renters hanging out around 60% of the area median income. But it's one of these things that as we craft housing policy, we want to keep some of these metrics in mind. Pattern puts out an annual report called Out of Reach, where we look at the average renter wages and the fair market rents in each county and across the entire region. This year, we did something in addition to that, where we actually added in typical living costs on top of that. So we used the special economic calculator to calculate, typical costs for food, transportation, healthcare, taxes, and other basic needs like clothing. When you add those on top of fair market rents, you can see it actually gets really, really difficult. And there's actually not a single county in the entire region where a single renter can afford a 1-bedroom apartment and what we call modest yet adequate living expenses. So we're not talking about living high on the hog here. We're not talking about going out to dinner. We're talking about adequate but very modest living expenses. And so this is something that the entire region should be concerned with. You can see in Sullivan the gap on a monthly basis between two working renters. If you have two working renters living together, they make about $300 more per month than their rent and their average costs add up to. So at the end of the month, you have about $300 to $400 left over. I don't have to tell you all, change your tires one time and that money's gone. Have one health problem that month and your money's gone. I mean, that is not a big cushion on a month-to-month basis. So you want to get back to talking about how housing is connected to health. Do you think if someone's making, pretty much the same amount of money as they spend every month on housing and modest yet adequate living costs, if they get sick and they have to go to the doctor and they think it's going to cost them too much, do they go? Maybe they think about it twice. Are they going to go for regular checkups? Are they going to go to the local health club or engage in hobbies that are good for their health but may cost them some expense? I mean, the chances are no. So this is why living costs and housing costs ultimately factor into overall community health. It is the question at the end of the day, do you have enough income left over to not only participate in the economy in ways that we would like you to, but to do things that are good for you? And that's how you connect housing and living costs to health. So why is this happening? I mean, why is it that so many of our costs, housing, expenses, why is it getting harder for people across our region to achieve home ownership? Well, there's a couple costs that we think at Pattern play a role. One of them is childcare. So in 2023, next year, Pattern is dedicating 2023 to doing a very large regional study of childcare, because as I've gone around the region, childcare has come up in practically every conversation I've had. And it's come up for a few reasons. One, it is slowly disappearing from many corners of our region. So we've had a lot of childcare centers close across the region before the pandemic, during the pandemic. There's a lot of reasons for that. One of the interesting reasons for that is actually the emergence of universal pre-K. So universal pre-K is a wonderful thing, but when you take the 4-year-olds out of the childcare centers, the economic model that the childcare centers depended on to survive kind of collapses on itself, because the 4-year-olds were the most valuable children within a childcare center. And that goes back to ratios. So you can have one staff member, I think it is for every 10 4-year-olds, but you need one staff member for every 3 18-month-olds. So now the 4-year-olds actually bring in a lot more money than the younger kids do. You take them out of the childcare center can't make it anymore. There were also challenges related to some of the regulations. There's challenges related to just making sure there's enough kids in a community to actually sustain a childcare center. We've seen a lot of them close. The result of that is that, before the pandemic or during the pandemic, we had about 5.1 million women out of work who were in the labor force, left the labor force during the pandemic. And then there's still about 1.2, that I have an updated number, 1.2 million women who were in the labor force before the pandemic who have still not come back. And childcare, according to the National Women's Law Center, is the single biggest reason for that. The other reason we need to be interested in childcare is it's very expensive. Childcare across our region averages from $800 to $1,300 a month for one kid. Okay, you saw some of these margins related to housing. For 2 kids, you're talking $2,000 a month. In many cases, that's going to be more than a person's principal, interest, more than their mortgage payment. So this is an expense that is really weighing down, especially our young families. It's preventing them from being able to save up for down payment and closing costs. And it's something that we really need to pay attention to, understand the model of governance, understand the model of service delivery. And we also need to understand why, even though this service is very, very expensive, childcare workers are among some of the worst paid workers of any service sector in our entire economy. So it's really, really a big challenge. Now, you pair childcare up with something else that's weighing down young families, and that's college debt. So across the region, the typical family of 2 averages about $800 a month in college debt payments. I can tell you, when my wife and I got married, between childcare and college debt, we had about $2,300 a month just in those 2 things alone. And you imagine how hard it was for us to be able to save up for a down payment and closing costs on a home Imagine if we didn't have that $2,300. I mean, we could have done it in a few years. Look here on this chart. If you take the average rent, the average income for a two renter family, and you take away childcare and college debt costs, now that family's down to $39,482 before taxes. Think about trying to buy a home or live comfortably in Sullivan County on a family income of $39,482 before taxes. It gets really difficult. I mean, it gets really difficult. Even the AMI, your area median income in Sullivan County, $75,700. Take away childcare and college debt, you're down to $51,700 before taxes. It's pretty hard to save up for that house, right? It's pretty hard to cover rent in some places. So when we think about housing, the cost of housing does not exist on its own. The cost of housing exists along with the cost of childcare, the cost of college debt, and things like that. So how does this affect the region? Now, the way this affects the region is that young families have to make really, really difficult decisions. I'll go back to my own personal story. When my wife and I got married, we had, as I mentioned, about $2,300 a month in childcare and college debt payments. And I went out and got a second job to try to save up money so that we could own a home. But we had to sit down and have a real difficult discussion because we didn't think that we could save up money to buy a home and have a second child. So the question for us was, do we try to buy a house or do we try to have a second kid? And in the end, we decided to try to save up for a home. So we have one child, and not to be morbid, but what that means is when my wife and I die, we will not have replaced our own population. And guess what? This is happening across the entire region, frankly, outside of our Orthodox communities. So you see here across the region, you'll see Columbia County, birth rate since 1997 down 27%, Dutchess 20%, Greene 26%. You look at Putnam, Westchester, Ulster. I mean, look at your neighbors in Ulster County. They're having almost 400 fewer kids than they were in 1997 every year. In Sullivan County, you don't have the same year-round Orthodox population that they have in Rockland and Orange County. And just being frank, those populations really skew these data for Putnam and Orange County. If you carve out the Orthodox communities, the trends in these counties are exactly the same. We are having somewhere between 200 and 1,000 fewer kids every year in each of our counties than we did in 1997. And this is at the root of it. It's the cost of housing, cost of childcare, cost of college debt, taxes. I mean, all these things pile up to make it so that families don't have the expendable income to have 2 and 3 kids anymore. Now they're having 1 and 2. If you look at what that does, on top of that, the region has been going through what we call a prolonged period of outward migration. So the Internal Revenue Service does a great job of tracking the migration of people across the country from county to county to county. And over the past 15 years, generally, our region has been losing somewhere around 5,000 to 7,000 people a year to outward migration. That means we have more people moving out of the region than we have moving into it. Generally, the people who are moving out of our region have gone to 2 types of places. If they stay in New York, they're generally going to New York City or to Albany. There's a little bit of a return to urban centers. There's a little bit of a return to job centers. That's where they're going within the state. If they leave the state, they tend to go to places that fit the category of better weather, lower cost of living. And those places are the Carolinas, Florida, Arizona, places like that. And you can see here, we did have a reversal of this trend during the first year of the pandemic. No surprise, we had about 48,000 people from New York City move into our 9 counties during the first year of the pandemic. It'll be interesting to see those data for the second year of the pandemic when they come out next year. But last year was the first year in about 15 years that we gained a net number of people from inward migration. It was only about 630 people, but it was the first year we didn't lose multiple thousands of people. So what does this all mean? What it means is you look at sort of the structural, the mathematic structures of the workforce. If you look at the workforce in two cohorts, and you take the two oldest cohorts and the two youngest cohorts, the difference between those cohorts is about 100,000 people. Now, this doesn't happen all at the same time. But what it means is that as you have people retiring out of the workforce, there are fewer people coming into the workforce in their late teens and early 20s. And that means all these, job centers that we're attracting, all these businesses, the warehouses, the medical centers, they're going to have a harder and harder time finding work because, simply put, there's not as many people. There's just not as many people in the labor force over time. As the boomer generation retires in greater numbers, the generations coming up behind them in our region are smaller on a numbers basis. So some conclusions, and happy to answer questions and connect this back to the health rating discussion, but there's a significant misalignment in our workforce that we really need to care about and think about. The greatest number of openings actually right now tend to be in jobs that do not require a 4-year degree. Some of them require a 2-year degree or a certificate or some special trade training. The cost of housing, childcare, college debt, other expenses are making it really hard for young families right now across our region. You can see it in the data. The pandemic and other forces have really created a generational change in our workforce. And there's some things that I think we need to do about it. We need to really work harder to set the conditions that encourage more housing. I mean, modern zoning, better review times, building up where we can, and improving or encouraging density where we can, where it's appropriate. Missing middle housing. Listen, I grew up pretty poor. My family never owned a house. I grew up in an owner-occupied 3-family house. How many of those do you see across the region? That's like a zebra without stripes across the Hudson Valley, an owner-occupied 3-family house. But we need more townhouses, condos, owner-occupied multifamily homes, because that's sort of where the demand is right now on a cost basis. School districts need to be part of the conversation. As I said, really the highest job demands right now could be filled by kids, young adults coming out of high school, if we can funnel them into the right trades and into the right training programs. I think we need to meet people where they are to bridge the gap between the workforce supply and demand. It's clear that we can't just throw jobs up on Indeed. We can't just throw out trainings and expect people are going to come to us. We got to go to churches and high school football games and try to find people where they are and make them aware of some of these openings. And we need to really, really, really understand this. We need the full spectrum of housing if we're going to have the full spectrum of workers. We can go off and try to just build nice homes and have zoning that's only for single family homes on big lots. If we want to be a playground for the landed gentry and the bourgeoisie, have at it. But guess what? There's going to be nobody to work at our grocery stores, at our schools, at our hospitals, which gets me back to my very first slide. I'm going to tell you a quick story and then I'm going to shut up because I know I'm running out of time. This top picture of my parents with my son, they were taking a walk. I just wanted to share my story quick. My dad worked at ShopRite for 48 years. My mom was a medical records clerk. As I say, we grew up very lower middle class in Orange County. And I grew up in an owner-occupied 3-family house. And I often wonder if my mom and dad were my age right now, working at ShopRite and working as a medical records clerk. I mean, could they even afford to live here? And I think, unfortunately, the answer is unlikely, that it's probably no. And so we need to understand, when we talk about housing, when we talk about affordable housing, when we talk about rental housing, when we talk about smaller homes on smaller lots that give people an opportunity to own a home that's modest. What that does is it allows people like my parents to live here. It allows us to make sure that our grocery store shelves are stocked. We all care about that. If we want to call the local doctor's office and have our medical records transferred, you need people like my mom. If you want to go out to a restaurant and have a nice meal that's cooked for you and served to you, we need housing for people who do that sort of work. So I would caution every community that I talk to really, really think carefully and speak with your lawmakers who have the strings of zoning in their hand and other tools as well, to make sure that we are setting the conditions that encourage housing for the full spectrum of workers and not just for the people who can afford the really nice home on the cul-de-sac. If we continue to do that, we're going to live to regret it as these services that we need and enjoy begin to disappear as the workers do. So that's my presentation. I'll just share. We have a lot of research that we do on housing. It's on our website. I'm more than happy to share it with anyone who's interested.
Thank you, Adam. I appreciate that kind of the demographics and the workforce piece and the childcare piece and how all these things interrelate to one another, because they really do. We did have one question so far. How about more little houses for single people? Do you know anything about that? Do you need more expansion on that?
Yeah, we just did a project for Habitat for Humanity in Columbia County, and one of the things it revealed, other than some taxing and assessment structures that get in the way of keeping those homes affordable for a longer period of time, we are building a very different housing stock than we did in the 40s, 50s, and 60s, when we did build more small houses on small lots for single people, for families just starting out. We are tending not to build that sort of stuff now. And so again, housing is tough because it doesn't always follow typical supply and demand forces now, right? Because right now, if it did, we'd be building housing out of our ears. I mean, the demand is super high and the supply is very low. So if it followed typical supply and demand, there'd be building proposals going on all over the place. So we really need to pay attention to this and see what we can do to encourage the construction of things like smaller houses for families who need to be able to afford those. I see this other question: can our infrastructure support higher density housing? If not, how do we fix that? The answer is yes, but not everywhere. And that's not going to be everywhere either. I mean, you're not going to put, I don't know, think of the county. You're not going to put the sort of infrastructure that's needed to support high density housing, in Ulen or out in North Branch or somewhere like that. That's not going to happen. But that sort of infrastructure exists in our downtowns, in our Monticellos, in our Liberties, in our Fallsburgs, in our, even down Woodsboro area, Bloomingburg. I mean, you have areas that have good water and sewer infrastructure, and you got to make sure that the infrastructure matches up with the right kind of zoning. And then you really got to go out there and beat the bushes to find developers and articulate your needs to them so that they can come in with proposals that are supported by the community and also supported by the needs. I mean, it's really important. You guys had a good housing plan done for the county that looked at the needs. And that's what you need to work toward, is the needs, because those are the needs of the people who are living in your county now. And making sure that you can meet those needs through smart policy is vitally important.
Thank you, Adam. And that's a great segue into Jill's piece. So Jill, I'm going to share my screen. Again, can everybody see the screen here? Jill is the executive director of the Sullivan County Land Bank, as well as the deputy commissioner of planning. She's also my friend and former coworker. So I'm happy to have her on tonight. Jill, take it away. Tell us about the Sullivan County Comprehensive Housing Strategy.
Okay, thanks for having me, guys. So this is a presentation that we presented to the Sullivan County Legislature that I tweaked a little bit. So if anybody watched that, I'm sorry if it's redundant. But yeah, we just want to give you a kind of an overview of the plan. And I want to speak to Adam's points of, I myself being born and raised here in Sullivan County, I had to put 3 kids through daycare at the same time, as well as pay my student loan from Columbia University. So I feel the pain of our local people who are struggling with bills and stuff. But I think this was a really great time after 22 years at the county, where we had some housing programs when I first came on board. Those programs kind of waned. But last year, our Sullivan County Legislature was proactive in putting money forward to allow us to address the county needs and assess what's out there and figure out what our housing issues are, because housing is a major need for the county. So I'm just going to kind of go over the process, what are the findings, and then go over what we've been doing to date. So this started earlier this year. We brought a organization called CZB, a local, or not a local, a nationwide housing consultant on board to do the housing strategy. We convened a housing task force made up of John Little and a couple of people from his office up at the county DFS building. We had REPCO, which is a regional housing organization that's been helping us out with some of our housing programs in the county. And then a local landlord and the housing authority in both Monticello and Woodridge participate on the committee and start to gear us up. So the consultant went through and analyzed all of our conditions. We met with stakeholders around the county that work with varying housing groups and different organizations, and they came up with a great plan. We got input too through a survey where we had tremendous input from the local community, because housing is a critical issue for Sullivan County. So you can go to the next slide. Yep. So again, this plan was kind of put together to help not only the county, who was proactive again in putting the resources to create the plan, but also for our municipalities and local organizations, and hopefully private developers looking to build housing throughout the county. And I also want to kind of go over, you can go to the next slide too, Shannon, that, when we talk about affordable housing, I know some people are concerned about the connotation of that, or that subsidized housing. But like Adam mentioned earlier, affordable housing is that, 30% of your take home income is going to housing related expenses. And so that, that's what makes housing affordable. And so we want to make sure that that sector is addressed. So when our consultants came on board and did some of their analysis, they were able to determine that there are 4 key markets in Sullivan County. And I'm sure probably some of you can realize that the rural southeast portion is kind of more of our commuters who, are here and working outside of the county. The rural northwest market identified as a separate market. Those 2 Liberty and Monticello Village cores are its own anomaly. And then you have the outer core of those communities. And they're all very distinct markets that really have changed either, even throughout COVID. So if you go to the next slide, yes. Here you can see that our weakest market is that core villages. And that's kind of where the Sullivan County Land Bank has been focusing its resources, really trying to boost up the percentage of owners and renters. You'll see in the villages, you would like to see that 68% of home ownership be a strong market. So we have that in most of the other sectors in the county where the majority of homeowners is greater, but in our villages, that number is a lot less. And there is a lot more poverty there. And a lot more renters. And so that kind of signals a weak market. And so that's where we're trying to focus some of the land bank's efforts to really start to beef up our home ownership there. And again, that kind of goes back to what John Little was saying earlier about the socioeconomic factors of health, and how, if you're not making a lot of money, you don't have good living conditions, your health's not as good. So those are areas we want to kind of focus on. Next slide. So I think in those 4 different markets, you can kind of see throughout the differences in the market. I think one thing that we show here is that there is a high vacancy rate in the village, even though it appears that there's not a lot of housing, there is some vacancy. But again, that gets back to quality and affordability. And so what is actually out there and what can people actually use? Next slide. here we're telling you about the different average sale prices and the gross rent. So as you can see, that southern portion of Sullivan County has a much stronger market. The sale prices are much higher. It's a strong market. There's more demand there. But overall, the county is pretty good. But again, look at the villages. It's half of the price of the rest of the county. And, you know, again, they are a high tax burden as well. So that also has to be taken into account when people are looking to locate. You know, you move into the villages, not only will you have a high mortgage, but you'll also have a tax burden. And then also the rents, you'll see they're basically all across the board similar. And even though the houses are cheaper, the rent is still pretty high for the village. So it's a shame that they're being high, you know, cost burdened drastically in the villages. So out of those, you know, these are some other key findings that, you know, our housing stock, the majority of our housing stock was built prior to 1960. So we have a lot of aging housing stock, a lot of distressed housing, especially in the villages, because there is, you know, low income who don't have the ability to reinvest into their property. We have a lot of seasonal units, especially in that outer core of, you know, Thompson, Liberty, those areas. So that's hard to turn those into kind of year-round houses. And then our mobile homes do play a good part in providing affordable housing. But again, those people are cost burden as well, because not only are they paying for their mobile home, they're also paying a lot fee and some of those other fees that come along with a mobile home park. So like Adam said, our sale prices have skyrocketed. In the village itself, even prices doubled there. So, you know, how do we get our locals the ability to purchase homes when they're already cost burdened, and now they're competing with somebody who's looking to buy a home coming up from the city? So we're really pricing out our locals in our market. And even though I think, like Adam pointed out, that there is some inventory, 3-month inventory, it's still high priced and poor quality. So it's really hard to get people into an affordable housing situation. And I think this was a good example that we had when the land bank sold one of our homes. Actually, we sold a property adjacent to a home that somebody purchased, but they had gotten kicked out of their apartment during COVID. And they were like, we don't ever want to lose our home again. So they were able to buy up here. They moved up from Orange County, but they wanted to make sure that their housing was secure and stable. And so they purchased a home so that nobody could kick them out. And so we would like to see that happen more often. So here we talk about affordable housing prices. You know, they say it's about 3 times what people make. And so, you know, what people can actually buy. And so right now our market, even though it has gone up, is still considered affordable, that there are still prices out there that can work. Unfortunately, it's for that median income and above. It's really not for anybody below that, you know, $60,000 range. And so how do we get some of those people into housing is one of our feats that we are going after. Next slide. So like I said, a lot of our inventory requires major rehabs. We are looking at programs to kind of assess that. But because we don't have a lot of people here, it's hard to attract quality developers. You know, our schools aren't the best, but they are good. And, you know, because the villages have that high tax burden, it's really hard to kind of build these robust neighborhoods and housing developments. And then here's our rentals. Our rental data, again, is skewed, I think, a little bit. It's based off of census data, and we know that our response rate in Sullivan is a little underrepresented. So some of these numbers going through, you may disagree with. Again, this is based off census data. But, you know, it shows us that we do have a high rental vacancy rate, meaning that, you know, compared to the other area. So we are in short supply. I don't know if they're in good condition. We've heard varying degrees on that. Next slide. This is where we kind of disagree with this average gross rent for 2020, according to our survey, the consultant, that it's $1,000. And from what we've heard and what we see on Facebook and what people are looking to rent, we believe our rents are much higher. And I don't believe they take into account a subsidy. And so it's really hard to gauge what the actual average rent is in our community other than using this census data. So this is the data that they presented to us. So this is kind of what we've been going off of. Next slide. So here's where Adam talked about the cost burden, anybody spending more than 30% of their income. And you can see as the lower the income, the more cost burden people are and how much more money they're spending on their housing resources. And so, you know, if they have to spend the majority of their money on housing, that doesn't allow for more spending on other things. When we did this, you know, our consultants did some analysis and it shows that, you know, for what it would cost to construct new rental and what, you know, we would have to charge in rent, we would definitely have to subsidize that development. It's just not affordable to be able to build and allow people making what they're making be able to afford the local rent. And so unfortunately, given high rising costs, it's just not going to work. So, you know, it would cost us about $250 per month or $2,500 per month to build new construction. And if our rents right now are at $1,000, there's got to be some give or take there to actually make it happen. So we just don't have that supply right now. And the same thing for home ownership. You know, to build this new home, given the rising costs of construction, given land acquisition costs, everything else involved with building a home, it's going to cost you over $300,000. And what household can afford that? You have to make at least $100,000, and then that doesn't again take into account the taxes. The land bank recently just built 3 new homes, 2 in Liberty and 1 in Monticello, that cost us over $300,000 to build for I think it was a 1,700 square foot home. And we had to subsidize it to allow us to get a homeowner in there that's making the area median income. And so you know, it's a great program and it gets our homeowners in there, but it's not sustainable. And so what can we do to provide more homeownership opportunities? So our plan really showed us that our people making under $50,000 are the ones that are being stressed, and how can we provide adequate and affordable household housing for these residents. And you know, the sad thing is that 35 to 50, that's your account clerks, that's your secretaries, that's you know, your laborers. They're not making a lot, but we want to figure out how to get them quality, affordable, healthy housing, and what can we do. So we just want to make sure that that's kind of where our pinch is. And so it even showed in one of our, I didn't print that slide out, but that people are living in under housing, like they're paying less rent in a property that's not conducive for their family, because there's no options for them to move up to better quality housing. And then that housing would then open up for people at a lower income. And so we need to provide better steps or better pathways to get people into better housing. And I think this is where our online survey really kind of showed. I mean, we had a lot of people respond to the survey, which was amazing. It was great to get feedback back from the community, because sometimes people don't participate. And this was an active way for people to kind of give in and show us that, yes, there are poor conditions, there is blight, people don't like that, they, they pay a lot in transportation costs. So how can we kind of help it and ground truth the plan to make sure we are making quality impacts and quality strategies to help and address our housing needs. So this was great feedback that we got. So based on that, then the consultants were able to kind of come up with our priorities. And knowing that we do have limited resources and capacity, it was great to kind of, show where we should focus. And that race basically is in that under $50,000 household. If we can start to address our housing needs to make people who are living and working here and making under 50,000, and that's our single family moms or single moms and some of our lower laborers, just get them into quality, affordable housing, then hopefully then that allows people to bridge and move on up the ladder to better housing choices. So the three opportunities that they kind of identified was to do this to kind of increase and improve 240 existing rental units. If we can start to rehab and do some of that work in our communities to bring up the current rental inventory and improve the condition of those. And then of course, make sure that some of them remain at that affordability that will allow us to then move some people up there. If we plan on creating 40 new units of rental housing with, marketing it to that 20,000 to 35,000, and then 40 units in that 35 to 50 range, we'll start to create more housing opportunities for our residents to be able to provide more resources. And so luckily, this 40 to 40 units, we are, through the Sullivan County Land Bank, we are working with a developer right now to start to do some of this more housing. So we are working with a developer out of the Hudson Valley who is working on the Monticello Manor site in Monticello to provide housing. And so that will help us to get to some of these targets and hopefully bring more affordable housing online. Right. And here's where, in addition to those three, we want to do some of the other things. So this is where we want to invest in our quality of place. This is why we're focusing on those other health issues, on our other parks and recs, and doing other things to make sure that our community it benefits everybody. This gets to the question somebody posed earlier about investing in our infrastructure, making sure our water and sewer infrastructure and our roadways are all working and can handle this influx of housing. And again, providing mixed income housing allows us to, kind of commingle people. So we're not putting all the subsidized people to one side and the second homeowners to another, that if we can create a community that has mixed income opportunities, you get a better community all around. And also by clustering our investments, when we have one over here and one over there, you don't see as much impact. So if we can start to cluster and show some greater impact in certain areas, that will help us to meet our need as well. And in addition to those three main activities, they also recommended some complementary activities. And this was, our low-income housing tax credit projects. Those are projects that already receive credit to build in the communities that we now want to extend. After 35 years, 40 years, they can then sell those apartments off the market, off the grid, and then they are no longer subsidized. But then, we lose, there's a potential that we could lose those housing developments. And so then those apartments would turn into market rate and price out a lot of people. So if we can start to continue to increase those housing tax credits or re-up them, we can make sure they stay affordable in the long run. They also recommended creating a list of our landlords that may have a troubled history. Again, there are good landlords and bad landlords. So really trying to accentuate the positive and, you know, kind of clear up our landlords and make sure everybody is working together, along with our code enforcement and making sure we are providing safe and quality housing for our residents is key. And then, like Adam also mentioned, providing land use regulations and other programs to kind of help make sure that we are planning effectively for these housing developments. So here are our next steps. We did get the plan adopted by the Sullivan County Legislature last month, so we have been moving forward to really implement the plan and move forward. It's so important, number 2, identify potential funding streams for implementation, that I put it on there twice. And so I think like that shows that the importance is there, and that the county now, not only did they fund this plan, they are actively working to figure out how to create a housing trust fund. And they have, you know, proposed budgeting $200,000 for 2023 to start to tackle some of these housing issues. If John Little was here, he would tell you that number 3 is crucial to address our emergency housing needs. Most of our our renters are one fire away from being homeless. If a fire in an apartment complex happens, that impacts a lot of people. And so our homeless aren't people living on the streets. They are our neighbors who might lose their home or lose their apartment. And so we have to be cognizant of addressing our emergency housing and making sure we have adequate places for people to go if they become homeless for a night or a week or, you know, a month. And then we want to address blight and single family rehab and affordability. And luckily, the county has been successful over the last few years with getting community development block grants. So we do have some homeowner assistance and rehab assistance for our homeowners. So definitely I'll speak about that in a little bit, but we are trying to tackle that more and address our blight through the Sullivan County Land Bank to really start to clean up some of our problem properties. And again, number 6, we've always tried to do this. I know it's a little hard because everybody is home rule state, but you know, the county is always trying to actively pursue helping the code enforcement. I know it's a tough job and it's not done, you know, it's not done in vain. They are doing tremendous amount of work. And so if there's ways that the county can assist them, we are looking to help out in any way. And then I think I just wanted to end with the housing grants that we do have available right now in Sullivan County. So we do have home buyer grants if people are looking to purchase their homes, given that the market has gone up. If you meet the income eligibility, you can get up to $45,000 to help buy down the cost of your home. And that can, you know, kind of alleviate some of that cost burden and get you into a home right now that's probably priced a little too high, but is there to help offset that. In addition, we also have the housing rehab grants. This is new to us in this latest round, but this will provide housing rehab for people who currently own their homes. So I think we want to kind of address that and start to build that up so that gets to some of this issue of our homes that are aging and have an old housing stock, that we can start to renovate those and get those fixed up. And then the last program we have is the mobile home replacement program. That one only works if you own the mobile home on your own property. Unfortunately, it can't cover people in a mobile home park. But if people are living in a substandard mobile home or an aged mobile home, we can work with them to replace the unit and get them into a safer quality home on their own property. So I would encourage everybody, and I guess I apologize, I didn't put the contact information, but I can have Shannon email it out to everybody to reach out
Absolutely.
to REPCO if there is interest. So I think that's it.
Oh,
Well,
thank you, Jill. That was a wealth of information. I really appreciate it. We did get just a couple questions. First, Rob Eggleton, the supervisor of the town of Rockland, is on the call, and he asked, should we be looking at rent stabilization areas and restriction? Do you have any comment on that?
I can say I'll look into that. That wasn't really brought up. I mean, I guess that's, I am concerned about capacity and the ability to manage and maintain programs like that, and whether the town has the capacity to kind of do that. But, I think looking at opportunities where people can create housing or provide incentives at the local level, and that might be something too that we can have Patterns work with us, but to identify what the incentives are to get people to want to lower their rent or to provide a lower rent would be important.
Do we have other questions? I know Rob asked another question that I think Freda answered in the chat.
Oh,
for
did
everyone
she?
to
Yeah.
Yeah, do we
About
we
short.
have other questions for Jill from the room? If you can either just unmute yourself and ask, or type it in the chat box if we have other questions for Jill. Housing plan, how can people see the housing plan, Jill, the housing strategy?
The housing plan is at sullivanhousingstudy.org. And also it's on the county's website. I believe on the planning website, there is a housing resources page. And we are kind of figuring out how to migrate the information from the housing study website into our own county website. But that domain will exist till I think June, until we figure out what to do with it.
I wanted to ask, how are you coordinating the energy cost with new housing and make it affordable for people to go into new housing? And also for landlords that need to be paying a higher cost of energy to be able to maintain their place. If not, they will have to they will have to pass it over to the tenants. So is there any way where you could navigate that situation where you could get help on both sides?
There are programs in place, and Shannon, maybe Sean Welsh at Cornell Cooperative Extension. He is doing a lot of programming for energy improvements and upgrades, because we have a high energy cost burden on top of our high housing cost burden. For the 3 new homes that we built for the land bank, we did use the heat pumps. There aren't oil burners. We're trying to kind of get away from that. And so those seem to be doing well. But there is a high burden. So I think between
how is solar energy coming into, because I see there's a lot of incentives for people that have homes to go into solar energy. So is that being considered for low income, multi-dwelling housing also to bring down the cost of that type of housing for low income?
I think when they are looking at like the multifamily, the larger housing developments, those are playing a factor in it. It's hard to kind of put those systems on the new homes, like we've said, when we're trying to transition a renter to a homeowner, by now giving them a fancy home with solar panels and all of these other things, like they've just gotten a new home and now they're going to have to learn all of these new fancy things. You have a season.
No, but what I was mentioning was like in the college, they have these huge acreage of solar panels. So
Yep.
if you're creating a development, can't you create a side thing where you could keep these solar panels to bring down the cost of energy for these multi-dwelling, low-income housing?
Yeah, definitely. That that is up to the developer who's bringing it to the table, and that would be kind of on us as municipal people and our planning and zoning boards to kind of mention that and encourage that. It does make sense. There are programs out there through NYSERDA and through NYSEG where these developments can tap into energy tax credits and other programming. So I think it would be key to start looking at those types of programs to encourage that, because if we spend more money up front on those systems, the long-term effect, it dwindles, it's
Yeah,
not a
I mean,
constant cost.
in the long term, those things pay for themselves.
Right.
And they end up bringing more affordable housing for people that are low income. Because now the cost of energy is less. So you don't have, so you can make housing more affordable. I've worked in social services for over 20 years. I was a caseworker, adult protective, child protective. So I know what I'm talking about because I know I see the need for housing, low income, but we also can't have too much density in low income housing because what happens is that's when you come with drugs, all the other things that come with low density housing. I mean, high density housing with low income people. That's why, like I said, with the mixture, like you saying, that's good.
Right.
But you also have to make housing affordable. And we don't have the income out here for people to pay for high rents.
Right. Well, and that's a great question. Rob Eggleton just asked in the chat is how do we increase wages to help offset housing costs? And I think that's a national dilemma of how do we increase those wages and how do we get people to earn more so they can have more buying power. And I sadly I don't have an answer for that, but I think it's key. Like I think the minimum wage hasn't gone up as much as housing costs have. So how do we balance some of that stuff out?
And me coming from the social services background, most of these jobs they get IDA, incentives to come here to bring jobs. Most of those people that end up in these jobs are subsidized by the county through healthcare, food stamps, because these workers are not able to maintain themselves because if you work at a Walmart or any other kind of factory work, you can't maintain a family.
Yeah. And there's
Okay.
no incentive to move out of it. So I think like that, it is a dilemma. And I think it's one that we are trying to all work collectively on trying to come up with those tools to kind of create better quality, affordable housing. And I think, was there another question
Yep.
there from Dr.
Yeah, I think Maureen had a question or a comment. And then we also have one additional one in the chat. I'll let Maureen go first. Maureen, your audio is not coming through for some reason. You're not muted, but it's not coming through. So in the meantime, Jill, somebody asked any consideration for Habitat for Humanity type projects.
Right. Our Habitat for Humanity in Sullivan County unfortunately lost its affiliation. They are going for bigger habitat projects. But I think that model is viable. I think the ability to have people kind of work or commit to working on their homes is something great. And I think the Sullivan Habitat is looking to kind of rebrand or redo. And so hopefully we can start to kind of bring that model back into play and figure out how to kind of grow that. I know that they did try to do one with the whole net zero and stuff, and then that got kind of expensive and given rising costs right now. But I definitely think it's an opportunity and a possibility to expand those types of projects.
And thank you, Maureen, for putting your question in the chat because of your audio difficulties. Jill, can you see that question?
Yes. We also want to attract the young professional and semi-professional, and they do not have housing available for them. What do you think is the median rent? Again, I think like they said, our median rent is like, I want to say it's like $1,200. But that, I just had this conversation with Aziz, our local government guy from NYSEG, about how our young professionals, when they move here, there really isn't adequate housing for them. So they either bunk up with 2 or 3 of their friends or they live with their parents. And so, how do we create that invisible market? Because you don't really know that there's a demand for that type of housing because nobody's building it. And so I think, how do we get that market rate housing and development here? That's where I think the municipalities are going to have to play a role in trying to encourage that type of development. And that's why, site control is key and making sure that we get the type of housing that we want will be important. It's definitely a mix. It's not just subsidized, but it's also, market rate housing that we are lacking. We are lacking housing across the board. So.
Or like me as a young professional, when I was starting out in Sullivan County, I got to move into Jill's family funeral home. So that was a cost-effective option for me as a young
Right.
professional.
Downtown
There weren't
living
many
in
options.
Monticello.
There definitely weren't too many options, that's for sure.
Question, how do we equalize the real estate taxes in the county? That's a big nut for everybody, whether it be landlords, whether it be individual homeowners. I work for one of the towns and I see the disparaging questions by a lot of the seniors, which is where you have a lot of the people moving out of the area because of the problems with real estate taxes, as well as anybody new coming in or any of the new, if you go out looking for prospective builders, they have to deal with the same scenario.
Yes, definitely. The tax burden is sadly high, and it is something that needs to be addressed. Liberty, Village of Liberty and Town of Liberty, I believe they have a tax abatement for construction of new homes that helps to subsidize the taxes over, a 6-year amortization rate. So that helps. But that tax burden is hard, and for our seniors who want to age in place, it's tough. And when they're on a restricted income, it is tough. And so I think like that's where the county has committed to kind of continue to address our housing needs. And I think that that's where we're going to have to figure out how do we start to get housing across the spectrum, from renters to assisted living at the end of life. So.
Thank you, Jill. And in the interest of time, I do want to wrap it up, but I do encourage everyone, take down Jill's email and number. Let's continue these conversations because they are conversations that we should be having. I know housing is an issue in all of our communities. That's why we're all here, in addition to getting credits. So I just want to thank again our 3 presenters tonight. I know John and Adam both had to drop off to go to other meetings, probably on housing. And Jill, thank you for staying for the long haul. I appreciate it. So I appreciate everyone's input tonight and engagement. And as always, connect with us. I am providing Sullivan 180's information here. I usually provide Renaissance's, but of course, as we are combining forces with 180, I encourage you to go follow the Sullivan 180 social media. And this presentation that we've recorded will be up on our Sullivan Renaissance YouTube channel, though, still before we merge all of those accounts. So please go like us, comment on Facebook. We'll be publishing more events and upcoming trainings and all of that there. And again, certificates for Planning and Zoning Board credit will be sent via the email that you provided on registration. So I'll be sending those out in the next few days. And again, I thank everyone for being here with us tonight. We hope to see you at future programs and to continue engaging in these important conversations. Happy holidays. Have a wonderful evening and take care.
Thank you so much. It was very educational.
Thank you, everybody. We appreciate it.
You too. Have a good holidays.
Take care.